Good morning or afternoon or evening, everybody, and thank you for attending this webinar. My name is Marloes Kibatcha. I'm the Managing Director at Africa Health Business. Before we start the webinar, I would like to take you through some housekeeping rules and give a slight background on managing the disease burden. The housekeeping rules you can see on the slide. The attendees will be on mute during the discussion. The seminar will be in English, and it's a 90-minute event. Please note that you can post your questions in the Q&A section on your screen, and your questions will be responded as much as possible. Throughout the webinar, there will be pop-up questions, and we encourage you to respond to them. And the results of the questions will be shared by me after the webinar. Next slide. I would just like to share a bit information about Africa Health Business, who we are. We are the organizers of this webinar series, but apart from that, we are a private consulting and advising firm with a focus on strengthening the private health sector on the African continent. On the slide, you can see the different services that we offer. Thank you. This is the program of today. As you can see, we have a very interesting lineup of speakers and sessions and a very great moderator that we are very proud of, Dr. Ian Barton, who will be moderating the session. This is just a partner spotlight, Medtronic Foundation, who we are very grateful for. Thanks to them, we can host this session today.
Medtronic Labs is built upon 5 principles. First, we design with and for the communities to address local barriers across the care continuum. Second, we employ evidence-based practices and protocols for uncompromised clinical excellence. Third, we address the social determinants at the root of poor health. Fourth, we integrate digital and product technologies for high-tech, high-touch models of care. Fifth, we innovate operational models that enable efficiency at scale. Learn more at www.medtronic.com/MedtronicLabs.
COVID-19 has had a great impact on health systems all over the world. Even though Africa has a relatively lower death rate, the continent has a high level of poverty and weak health systems. 75% of all COVID-related cases and deaths are in only 5 of the most affected countries in Africa. On the map, you can see these are South Africa, Morocco, Egypt, Ethiopia, and Tunisia. However, the secondary impact of COVID-19 in the African continent has been severe. Children have not received their immunizations, and the HIV, TB, and malaria care has in some cases stalled, and the disease burden has gone up. In addition, it's estimated that by 2021, 112 million people might be pushed into extreme poverty indirectly due to COVID-19, and therefore quick and decisive actions towards the prevention and against the spread are needed. Investing in health in Africa is not an option, it's a must. And in the current pandemic situation, it's an opportunity to build a healthier, stronger Africa. Investing does not only mean putting in money, it also means strengthening and building resilient health systems, infrastructure, and industrialization that can bolster inclusive and sustainable development in Africa for Africa. In order to develop, there is need for private sector participation in the provision of medical equipment, pharmaceuticals, digital health solutions, training, and human resources. Africa needs to become less reliant on health imports and focus on growing and strengthening internal medical supply chain on the continent. This session will therefore focus on innovative partnerships towards ensuring the continued delivery of health services during and post the current COVID-19 pandemic. Not only COVID-19, but health systems that focus on managing the entire disease burden that our continent faces. I would like now to give the floor to our moderator, Dr. Ian Barton, to lead the discussions moving forward. Thank you.
Thank you, Marloes. Good afternoon and greetings from Cape Town. I'm Ian Barton, and I'm the Chief Executive Officer of the Clinton Health Access Initiative, a well-known supporter of governments and the development of health systems and services that enhance access and quality of care for their citizens. And so resilient resonates with me and with us as an organization. But I'm really fascinated to listen to this great panel that we've got this afternoon around managing disease burden. I'm looking forward to hearing what the thoughts and the ideas are of this range of industry thought leaders, both from the public sector, multilateral structures, and also from the private sector. Our keynote speaker this afternoon is Maria Salpintos Castro. The Global Fund has been a vital player in the response to COVID thus far, providing advisory and financial support centrally and across their partner nations. Sol is the Senior Manager of the Private Sector Engagement Department at the Global Fund. She leads and manages the work on philanthropic engagement, focusing on major multi-stakeholder partnerships with leading consumer marketing initiatives, with faith-based organizations, with trusts and foundations, with corporations, and with high net worth individuals. Sol, what have you got to tell us today?
Thank you, Ian. Thank you very much. Can you see me now? Yes. So first of all, and before kicking off the slides, I wanted to warm welcome everyone, the excellent speakers today. And I want to especially thank AHB and Amit for having me today. And also for bringing together such an expert group of speakers that are going to discuss this important topic of managing disease burden, and while finding new innovative ways of addressing it, and within the current context of COVID-19. So with no more introductions, I would like to start with the first slides, please. So very briefly on the Global Fund, I mean, we have been fighting infectious diseases for the last 20 years while we build strong health systems. So the Global Fund Partnership has helped to save 38 million lives since inception in 2002 in more than 155 countries. So really addressing or fighting pandemics like COVID-19 is the reason why we were created almost 20 years ago for a different issue at the time, which was mostly the HIV crisis. And the way we do it, responding to these pandemics, is really by trying to provide equitable access to treatment, testing, tracing, strengthening supply systems at the country level, so we can really reach the hardest to reach with life-saving treatment and really leaving no one behind. Next slide, please. So the impact of COVID-19, as we all know, has different dimensions, certainly. I mean, definitely the one of the disease itself, but the indirect impact of COVID-19 which arises by the fact that service delivery are being interrupted because there is no access to very basic care. There is no access to treatment. We know that illnesses and infections and death resultant from these interruptions on HIV, TB, on malaria, on maternal care, on measles are going to increase for the very first time, and we are going to really reverse the gains made 10 years ago. So we know specifically for the Global Fund that approximately 70% of our programs since the beginning of this crisis have been affected. But also, and not less important, is the economic impact. So the IMF predicts, I believe, that only the African economy is going to contract approximately 3.2% this year. And we know the billions of dollars that they are being spent across the globe in lockdowns. So if we don't really tackle the issue rather than the consequence, which is really COVID-19, the impact and the collateral damage on livelihoods, on economies and businesses will continue to be devastating. And to do this, it's very clear that we need to do it together. We need to work together because we cannot see this fight as an isolated fight. So this is a fight that is embedded with many other fights about residual pandemics. And we need to very fast act. So next slide, please. So the Global Fund, as I was saying, was very quickly adapted to be part of the global response on COVID-19. So we are one of the founding members of the ACT-ACCELERATOR, which is the access to COVID-19 tools. Specifically, we co-lead the diagnostic partnerships and the health system connector, but we are also involved in the therapeutic partnerships, because eventually, when there is a treatment that is ready to be deployed, the Global Fund will be responsible mostly for the procurement and their deployment in lower and middle income countries. Just very briefly on the diagnostic pillar, on the 28th of September, we allocated $50 million to provide access to the most rapid test available in the market today for lower and middle income countries at a fixed price of $5 per kit. Unfortunately, this is nowhere near the amount of money we need, which is approximately $600 million in order to draw down the volume guarantee that we have secured with our partners for approximately 120 million kits. Next slide, please. And the Global Fund, since March, has very rapidly adjusted the way we do our work and the way we support our countries. And we allocated almost $1 billion to be able to fight COVID-19 through a four sort of way approach, which is, first of all, we needed to adapt our current programs, HIV, TB, and malaria programs. We needed to continue to protect our health workers while reinforcing the health systems and ultimately fighting COVID-19. Next slide, please. So what do we need? I mean, we need a lot, right? We all know. But I think basically this is a fight that involves us all. And in times of crisis, exactly what we need is private and public stakeholders to really step up and really show a change, a system change in the way we address global health security. So we need a global call to action for all. And in our opinion, this call to action should really touch us upon like three main topics. Leadership, certainly. We need leaders, private and public leaders that are ready to step up to show the way forward for others to join. We need that advocacy component to keep the topic, as we call it in the private sector, to keep the heat in the topic. So public and private is really addressing the issues. We certainly need increasing commitments. We need more finances and financial and non-financial commitments. I think you have heard that ACTA estimates that the total amount for the COVID-19 bill is approximately $35 billion. Only the Global Fund will need $5 billion in the next 12 months to protect the gains against the three diseases while fighting COVID-19. And to be even more specific, between now until the end of March 2021, we will need $1.1 billion exclusively for the diagnostic pillar. And we have seen G20 countries allocating trillions of dollars in providing rescue packages to really mitigate the impact of this pandemic on their economies. So just thinking what 1% of these trillions of dollars allocated in addressing the cause of this situation, which is COVID-19, rather than the consequence, maybe we would have a different picture today. So the same with the private sector. We know private sector has spent billions of dollars in readjusting and reallocating the way they do businesses because of the COVID-19. So certainly that 1% to strengthen the global response will provide us a different context maybe today. And I guess the last but not least, and this is very much, Ian, what you were saying at the beginning, is really what is the way forward, right? So once we manage to contain this emergency, this crisis, we shouldn't go back to business as usual. I think if one thing is very clear for what COVID-19 has brought upon us, is the sense that this is a fast track to really discuss and take action about global health security. And if we do that, we need to take care of health systems at the country level, because it's the only way. And we know that either we are all safe or nobody is safe. So hopefully, I think this is going to change the way we address these issues in the way forward. Next, please. So private sector, I mean, and this is really where my expertise is, right? For the last almost 14 years with the Global Fund. So the private sector is core to us. As you know, we are a public-private partnership. And certainly most of our private sector partners very rapidly step up and really address the issue and join the global fight against this pandemic. So we have partners like RED, Redirect, and mostly Apple and others, really redirecting their finances to support the C19RM, which is our mechanism response at the Global Fund. But we also have new joiners like FIFA Foundation, very rapidly committing finances or committing resources to support health workers. No less important is the piece of work we do really with Project Last Mile, Coca-Cola, and with Google and Rockefeller, really focusing on what is core to this, which is supply chain and digital health. Very, very relevant. But again, as I was saying, much more is needed. So this is really a call to action to really unite to fight and step up this fight. Next. And I think this is my last slide and the way I would like to conclude today and open up this discussion. I mean, this is a quote from Peter that, in my opinion, really encompasses all the key points about this pandemic. And the most important to me is that this is not an isolated fight, right? So if we fight COVID, we need to fight HIV, we need to fight malaria, we need to take this in a more holistic approach. And to do that, we need to have strong systems, because it's the only way that these systems can cope today with COVID, but tomorrow with something else, and certainly with the residual pandemics, which is HIV, TB, and malaria. So we also know that this crisis has an impact on all of us. So we really need to coordinate and do it together and unite the fight. We know that COVID-19 threatened the gains in a very tremendous way. We know for a fact that this year death rates and infection rates are going to arise across the three diseases. And this is very much given by the current status of health systems, but the fact that treatment and care is interrupted, by the fact that finances are diverted. So we cannot allow that. We need to be able to save lives. And in order to do that, we need to be able to open economies. But we need to do this with a more holistic approach. So just to end my last comment, I think we are at the tipping point of really being able to save lives, contain this pandemic, and this prevent from others to come. And that last point is very much about the way forward on how we are going to address global health security, very much linked to health systems. So thank you very much for your time, and I look forward for the discussion later today. Thank you.
Thank you, Sol. That was superb. I mean, the quote that jumped out for me that I've written down here in big capitals is keeping the heat in the topic, because it's been quite amazing to see how easily the conversation can be swayed by the news cycle. And you saw how much of an influence there was by the media on this focus on ventilators early on in the pandemic, when in fact we had no oxygen to run them. We had no tubing to actually deliver the oxygen to the ventilators. So yeah, they're really, really interesting to make sure that we keep the focus and keep the heat in the topic. I also loved your thing about remembering the three diseases. I've been saying to our people since March, the three big things we've got to keep focused on is, the one is remember to manage the core, the second is to respond effectively, and the third is to build back better. And again, it's easy to get pulled in that direction of build back better without actually spending the time on protecting the core. Fantastic numbers though. I mean, you're saying the Global Fund needs $5 billion additional in the next 12 months.
in the next 12 months.
On the 3 diseases.
Yes. And certainly on COVID-19, because basically, I don't know if many of you recall, our campaign for replenishment last year was really step up the fight. So we wanted to step up the fight. And that was pre-COVID world. But what has happened this year is certainly we had to adapt it to really contain and fight. If we don't fight COVID-19, we cannot protect the gains, or we cannot protect HIV, TB, and malaria programs. So that came on a sort of a first place, right? And this is where we are at the moment. So the numbers are crazy, I will say, when you look at what it means, what it will take to raise $35 billion for what exactly. I mean, the vaccine, which is, I think, is the greatest, is the greatest development in the way we are doing this today. But as you were saying, Ian, I mean, that is one piece of the puzzle in a way. Today, as we speak, we need people to be tested. We need oxygen, so people can use oxygen. We need the basics. We need PPE. We need health workers to be protected, because that same health worker is going to provide you with your bed net, or is going to visit you to see if you have taken your antiretroviral, or is going to do your COVID test, hopefully.
Yeah, I think that's, you talked about the antigen testing transition, and I just want to dwell on that for a moment, because I think the numbers there again are just mind-boggling. One of the most important things that I think has come out of this is this, and Peter describes it so perfectly in his slogan, "Unite to fight." The aggregation of effort has been quite amazing, and if one looks at this antigen testing coalition that's been put together with the volume guarantee for 120 million tests at $5 a test, that's a $600 million volume guarantee structure that's been put in place in order to ensure supply of antigen tests to low and middle income countries. But as you point out, that's probably half of what we actually need.
Yeah. Certainly, and we are not even, we just initiated this and kick off this idea of drawing down the volume guarantee with $50 million. So that is nothing. And if we really talk about reopening economies today, the only tool we have to do that is the rapid test. Because as Amit was saying, if in the future, in 15 months, you are at the airport and you can take a 30-second rapid test that can tell you, yes, you are allowed to travel or not, this is the way how our economy is going to resume, right? So we need investment in the research of development for the most rapid possible test. And the way we come into this picture is because we need to provide or guarantee the equitable access for everyone, because we don't want this test just for the high income countries, right? So we need everyone to have access to the same tools. This is what is clear today. Either we are all safe or nobody is. So certainly I think the testing and again, I think it's also a change management at the country level to absorb this. And as you know, things are happening so rapidly that sometimes countries are not able to cope with what we are asking them to do, right? Really create that demand. So we are very, very much working on this at the moment, certainly for the diagnostic pillar and the health connector, because I think, as we say, in the way forward, once we contain this emergency, hopefully very soon, we need to look into building back better, exactly what we were saying. And we cannot go back to business as usual. And the only way to provide global health security is by providing strong health systems or helping countries to build a strong health system to address today COVID, tomorrow something else, and really finally, for good, take care of the endemic epidemics, HIV, TB, and malaria.
So just to close out on the antigen testing piece, and thank you very, very much, Sol, for your comments and your input. Just for the broader audience, because I think many people are not yet fully attuned to what's happening with the change from PCR testing into antigen testing. PCR looked for RNA, needed to be extracted from a deep nasal swab or pharyngeal swab, and then took time in a machine to be quantified, and could take 24 to 36 hours, and was quite intensive in terms of equipment and people. The new antigen tests, it's an anterior nasal swab, it's a quick administration, it's a side room test, it's a lateral diffusion test with results in 15 minutes. And the collaborative antigen testing project is already kicked off across 14 countries across Africa. And to date, the initial batches of tests have been sent to each country, both the Abbott PanBio and the SD Biosensor Q, for local validation and training. The local validations they're largely complete for one or both tests across all the countries, and most countries are now already planning their national training of trainer workshops over these next couple of weeks. The whole program has been developed as a close partnership between the African Society for Laboratory Medicine and the Africa CDC. And so the largest volumes of tests have started to go out to country, and the validations and selections will be complete. And then those will be deployed across health facilities late November and early December. So we will see that conversion into antigen testing with 15-minute turnarounds at about a quarter of the price of the old PCR test, and that happening in this calendar year. So let's move on then. Thank you again, Saul, but let's move on to Philana Mugiene. Philana is the Sub-Saharan Africa Manager of Government Affairs and Public Policy for Terumo. I was looking up Philana's resume and saw that she's an attorney, so we have to watch our words. And she's worked at all ends of the healthcare space, from policy and practice at the World Bank and the IFC, through IP protection at SIGPA, and has even had a stint at British American Tobacco. Philana, I hope we're going to get some time to talk about the Terumo Medical Pranex, the training institute in Japan that I visited last year with African Healthcare Business and the Medical Excellence Japan Group. Philana, we need one of those facilities in Nairobi, and we need another one in Lagos. But Philana, thanks very much for joining us, and we look forward to your comments.
Thank you very much, Ian. And thank you everyone for joining us. Now, Terumo Blood and Cell Technology.
Every day in Africa, thousands of blood donations make the difference between life and death. But with the COVID-19 outbreak, many locations that used to host blood drives have closed their doors. And without them, we can't maintain a sufficient blood supply for people in critical conditions. It is in these times of crisis that we must come together as a community. So we are asking you and all healthy citizens to reach out, give blood, and save a life today.
Philana, you are on mute.
Okay, can everyone see and hear me now?
We can indeed now, yeah.
Okay, so thank you, Ian, and thank you everyone for joining. Terumo Blood and Cell Technologies, we're a medical device company, and our products, software, and services enable customers to collect and prepare blood and cells to help treat a host of challenging diseases and conditions. And we really believe in the potential of blood and cells to do more for patients than they do today. A lot of what I'm going to say is going to echo what was said about a holistic approach to dealing with the disease burden, and also on having oxygen for ventilators and the focus on oxygen rather than ventilators, because blood is a vital healthcare resource, and it's most often used in Africa to treat pregnancy-related complications, severe childhood anemias caused by things like malaria and sickle cell disease. Blood is increasingly being important for patients with kidney failure, for on dialysis. It's important for cancer treatments. And the World Health Organization states that the number of units of blood that are needed to sustain an adequate level of health is equal to about 1% of a nation's population. And that means about 10 units per 1,000 people in a population. And the problem is most African countries fall well below the minimum goal. And this is even pre-COVID. Now, there are many reasons for this. In some cases, we have weak policy frameworks for blood. There's generally limited investment, research, and resource allocation towards blood processing and collection. There's limited public awareness on the importance of regular voluntary blood donation among our healthy adult populations. And the bottom line is, even though blood and safe transfusion are essential parts of any health system, the safety, sustainability, and adequacy of blood remains a major health challenge in many African countries. And of course, what this means is that the disease burden for other diseases like sickle cell, like postpartum hemorrhaging, like cancers, all of these are exacerbated because of a lack of blood, which is an essential medicine. Now, as the theme of this discussion suggests, partnerships and collaboration are key to helping manage the disease burden that is being directly and indirectly affected by lack of blood in Africa. This is truer than ever in a COVID context, where Africa's blood services are, in some cases, collecting up to 80% less blood because of schools being closed. We get a lot of blood from students and university students, and also because of limits on social gatherings, and because we don't really have a culture of voluntary blood donation. So COVID has made a bad situation even worse. But this is why Terumo BCT are really proud to have founded the Coalition of Blood for Africa, or COBA. Now, COBA is the realization of a growing consensus that the agenda for blood and blood safety in Africa really requires a multi-stakeholder, multi-pronged approach with innovation to actually make a meaningful impact across the continent. And COBA is the first and the only sub-Saharan African platform that's dedicated to crowding in and bringing together people, resources, investment, ideas to really try and move the needle on blood and blood safety in Africa. Now, the next question is, how is COBA going to do this? And in very brief terms, it's going to do it in three main ways. The first way is reflection. We need more research, we need more policy analysis, we need more data collection around blood. And the aim will be to really help policymakers make informed decisions and take effective steps to establish adequate, safe, sustainable blood systems for Africa. The second pillar is focused around dialogue, things like this webinar. We need to have debate, we need to have advocacy, we need to have awareness raising and discussions around blood and blood safety issues. And COBA is going to be a forum where stakeholders can freely debate and discuss how to establish better blood systems and safety for Africa. And these dialogues will build trust and help assess challenges and identify opportunities and help reach consensus with a wide cross-section of stakeholders towards advancing the blood agenda. And the third pillar is, of course, action, technical assistance. COBA is going to carry out technical assistance that's going to be tailored to the needs of a particular initiative or in response to a specific event, like the Ebola outbreak, like the COVID pandemic. And it will include capacity building, technical inputs, for example, to help strengthen our legal and regulatory and policy frameworks. And COBA is really going to aim to be a repository for best practices in different areas related to blood, like transfusion medicine. Now, I'm really proud of COBA because in a very short time, it has brought together an unprecedented array of partners that include Africa Health Business, who are hosting this particular symposium, the Africa Society for Blood Transfusion, the Global Blood Fund, Epicenter Medicine Sans Frontières, Siemens Healthineers, Ogilvy PR, Africa Practice, and others who come from private sector, academia, research, development partners, civil society, not-for-profits, NGOs, the media, and of course, the public sector, the ministries of health and the National Blood Transfusion Services. And we think through partnering and coalescing around these three pillars, research, action, and dialogue, we will really be able to ensure that we are able to manage the many disease burdens that are exacerbated by a lack of adequate, safe, and sustainable blood in Africa. Thank you.
I think when people come to these things, Philana, they think that they're here to learn, but I got to tell you, I learned so much in these events as well, because I'm sitting here scribbling notes frantically as you're talking. Research, action, dialogue, great calls to action. But fascinating to hear what you're saying about 80% reduction in donations. Just a quick question. So we see a lot in the supply chain space about the use of drones for emergency blood delivery. I'm normally an early adopter of new ideas, but I have to confess I've been very slow to respond on this one. What's been your exposure? Have you had an exposure? Is there a focus within COBA to look at emergency supply to remote areas using drones?
Yes. So this is something very effective, and I believe it's being deployed very successfully in Rwanda. Now, Rwanda is one of the few countries in Africa that actually collects enough blood. And the interesting thing about blood, it's this whole oxygen versus ventilators kind of argument that you raised earlier. There's a lot that we could do to improve delivery of blood. Of course, at Terumo, we have incredible technology that can help separate blood components very effectively. There's so much out there. But the problem for Africa is we're not collecting enough blood. And until we're collecting enough blood, a lot of the amazing technology, a lot of the amazing innovation, it's almost redundant. Blood is the oxygen. We need to collect more blood. And if we're not even collecting enough blood to support 1% of our populations, which is the bare minimum, and now with COVID, that's even 80% less than 1%, it's very difficult to even start scaling up or thinking about the potential for some of these incredible innovations and technologies that are out there. As a first step, and if there's one thing that I hope everyone can take away from this, is we need to collect more blood. And until we do that, we're never going to be able to achieve some of our public health goals as a continent. We don't have so many problems these days with things like accessing a clinic or a basic healthcare facility. If you're in a car accident, you probably will manage to get to a clinic in good time. But the problem is when you get to the hospital and you need a transfusion for your emergency surgery, all too often there is no blood. Women are able to get to clinics to deliver. They're getting much, much better prenatal care than they were before. They're getting much better nutrition. But the problem is, if something goes wrong, and even in very, very good private hospitals, if something goes wrong and the woman starts hemorrhaging and there's no blood, that is actually what's going to kill her. Not access to a healthcare facility, not access to diagnosing the problem. It's just that there is no substitute for blood. It's an essential medicine, and it's almost a silent public health crisis that is often excluded or deprioritized, and it should be central to any strong public health system. So yes, there's a lot of amazing technology out there and innovation, which COBA wants to crowd in and scale up. But until we have enough blood in our blood banks, we're never going to be able to realize the potential that these technologies offer.
Powerful words, Philana. Thank you very, very much. And certainly resonates the stuff that we're seeing written so much now about the transition from the need to focus on access to the need to focus on quality. So thank you. We're going to move on now to listen to the words of Dr. Ademola Oliadi. Ademola is known to many, I'm sure. He's a public health physician and health leader. He's currently the Kenya country representative of the United Nations Population Fund. And in the past, he has served as the African Union Commission's head of health, nutrition, and population. Ademola, from the perspective of the UNFPA and from your own perspective, how has and how will the COVID-19 pandemic affect disease burden?
Thank you very much to the organizers, and thank you so much for having me. I think if we begin to look at the impact of COVID-19 on our health systems, especially as it relates to our desire to build resilient health systems and the disease burden going forward, it's going to be important for us to then take a step back and look from a different perspective. Let's begin to look at the whole issue of health in its broadest definition, which is the presence of that well-being. And so where that well-being is missing, we can start talking about the disease burden on the continent. And if you look at Africa and the impact of COVID-19, you would see that in a lot of African countries, including countries like Kenya here, before we started seeing the impact of COVID as a directly in terms of morbidities and mortalities, we're already seeing what some people call the shadow pandemic in terms of maternal mortality and morbidities as a consequence of the shutdown, the COVID response, and the fear it had impacted on people. We were beginning to see increases in female genital mutilation and vulnerabilities of women and girls. We were beginning to see heightened gender-based violence. And of course, we've also then seen that our health systems have not been able to cope in a lot of cases with the disease burden that has been a consequence. And so we've had to adapt very rapidly in a lot of cases. And I think going forward, as we build back better, that adaptation has to be the way forward. I would say that Africa's health systems remain in need of investment, in need of improvement that a lot of practitioners, including those on this panel and the attendees, have always known. They know what to do. The African heads of state in 2001 committed to investing 15% on health and committed to continue that investment at various other forums. We're yet to get there. So it's important for us that for our systems to be able to respond and meet the needs of Africans, we must start looking at our guidelines and protocols again. That where people do not need to come in direct contact with facilities before they're able to get care, we need to ensure that we can provide them that care where they are in a way that does not overburden the weakened human resources for health. We must strengthen our community systems. We saw that very quickly at the onset of the pandemic and the response, that a lot of health workers and development partners were unable to move into communities where the needs were great. And so we had to rely on community mechanisms and existing systems within those mechanisms to provide care, which also would mean that we have to begin to partner more with the private sector to leverage innovation, to leverage technology, and to ensure that health for Africans becomes a product that is delivered in households and within communities. And so where there's a failure of those systems to deliver, then we start coming in contact with the health facilities. And going forward, there is no doubt that the private sector has a critical role to play. And so we must find a way to rapidly scale up capacity on the continent to work with the private sector. The public sector on the African continent is yet to have the full capacity it requires to optimize the benefit that the private sector provides. We must pull down that mutual suspicion and then begin to look at ways of leveraging the efficiency that the private sector brings to the table. And of course, we must then ensure that there are policies that allow African countries working with the African Free Trade Area to leverage existing markets, so that we're not talking about 55 different countries with 55 different protocols, with 55 different market capacities, but we're talking about one integrated, prosperous Africa that is able to move forward. And now we would notice that in a lot of African countries, including in Kenya, we had some level of involvement, indeed, by the highest level of government. We've had the president address the nation about 13 times. So a problem that emerged from the health sector or a disease has got the attention of African policymakers across board. It's an advantage that we should not lose. We need to be able to come together as public, private sector, and as development partners to be able to help government concretely build back better, and the approach and the nitty-gritty will be somewhat different in each of the countries for them to adapt to their circumstances, to their community systems, and move the process forward. And most importantly is the fact that we must block leaks within the health system. One of the most important I would say ingredients and factors to build a resilient health system is that of trust. And one of the things that you would see that we're beginning to lose more and more on the African continent is trust. We must earn the trust of the community. We must earn the trust of the policymakers. We must earn the trust of the human resources for health. And so going forward, I have looked at the COVID-19 pandemic and its impact, and I think there are 4 key things that we need to do very differently as we move forward. First is ownership. We must ensure that the people themselves own their health. We must help people to be able to make proper decisions, take prompt action, and health producing behavior must be adapted. Secondly is leadership. We have seen to various extent difference in terms of leadership across the continent, and I do think that we can build on the leadership that has been brought to the table to move the process forward. Third is partnership. There is no country that has been able to mount an effective response without a public-private partnership. And we've even seen private companies that would either to have been competitors beginning to collaborate to move the process forward. And fourth is the trust factor. And here is one question I'd like to put on the table for us. For some reason, the COVID-19 pandemic has not fully modeled the projections that people have made for the African continent. And we have been unable to explain exactly why to the African population, to the politicians, to the policymakers, and to the communities. If we're going to be able to earn their trust and keep their trust going forward, we must come to the table with the evidence. We cannot ignore that and just move ahead as if nothing has happened. And the problem that is giving us is we're finding different countries responding in different ways without necessarily falling into the pit that we have assumed they would fall into. So I do think that we are at a unique opportunity to build back better. We just have to ensure that we now align our ducks, build the partnership, and keep the trust of the community to make the desired change. Over to you, moderator. Thank you very much.
Thank you, Ademola. Again, great, profound words. Someone put the comment up on the profound. Yeah, that impact that we've seen of the understanding that patients actually are quite capable of looking after themselves and making positive decisions and making informed decisions if we provide them with decent information. That community health workers can be a vital part of the aggregated service delivery model. Those are probably, for me, that thing of community health worker and self-care has probably been 2 of the most fascinating things to watch. And the role that digitization has played in that, digital health has played in that. I loved your comments on leadership and then partnership. And my take home is the one integrated, prosperous Africa. We don't need individualized care and treatment protocols for every disease within every country across 52 countries. So thanks, Ademola. I'm going to move on because I'm watching my clock and ask Vinay Ranziwal he's the Vice President and General Manager of Novo Nordisk Middle Africa. Novo Nordisk is nearly 100 years old. It was founded in 1923, and it supplies 50% of the world's insulin, and has a great commitment and a well-demonstrated commitment to work with health authorities and relevant partners for the prevention and management of diabetes. And they're also a strong and valued partner both of CHAI and especially of the World Diabetes Foundation. So Vinay, over to you. What impact has COVID-19 had on the management of non-communicable diseases and specifically on diabetes, and how has Novo Nordisk responded to that?
Thank you so much, Ian. And it's first and foremost a pleasure to be with this esteemed panel and engaging this august audience. I stand before all of you presenting our collective mission as Team Novo Nordisk. And we believe that our collective mission is that we need to drive change to defeat diabetes and other serious chronic disorders. And when we talk about COVID-19, it's all around us. It has become a global humanitarian crisis with severe consequences for thousands of people. And in that, specifically, if you see, people with NCDs and diabetes are specifically particularly at risk. And few reasons for that: the presence of diabetes very quickly had stood out as one of the major risk factors for increased morbidity, mortality from COVID-19. And also COVID-19 impact on access to care in terms of the hospital services and staff also negatively impacted the care for people with their chronic diseases like diabetes. Just the fear and anxiety of going to a clinic and then maybe contracting the infection has also affected the follow-up that all these people with diabetes need on a regular basis, and potentially compromising the control and the optimal outcome that they can get. And last but not the least, I think that is also a big impact, the impact of the economic hardships because of the lockdowns and the related impact on livelihoods. I think it also meant that some of the people with diabetes who have not even been able to have access to affordable care, they've not been able to buy their medicine, which is daily life-saving medicine. So for us at Novo Nordisk, our biggest responsibility is that we feel that we are committed to be there for people with diabetes, and specifically for the vulnerable patient groups who need our help the most. And in that, we believe that as part of our, we call it that together we should be working in partnerships to defeat diabetes. So that is our social responsibility strategy. And in that, one of the big pillar is about working on prevention. Then biggest one that is very relevant in today's time is access and affordability. It can be reach out. And I really like when Maria mentioned about, it is about taking everybody along, and it's ensuring that nobody gets left behind. And I think this is where it is we feel our responsibility to reach out to especially the vulnerable populations of people with diabetes and create some support systems for them. And we also believe as a company, as a world leader in diabetes care and supplying insulin, having the responsibility to supply insulin to more than half of the world's population needing insulin, is that we need to ensure that there is an uninterrupted supply of this life-saving medicine that can make a difference to every person who's using that. So with that in mind, we have been working on some key initiatives, the team across our 49 countries that we cover as part of Middle Africa. One of the key elements for us in terms of improving access and affordability has been the access to insulin commitment, in which we have worked and reached out to close to 78 governments across the globe with our commitment that human insulin in vials will be available at not more than $3 as per our commitment when we supply to the governments, to ensure that it is affordable and it is helping people who really need that. The second key initiative we also working, and we are looking forward to expanding that, is also there's a very small but very vulnerable patient group, children with diabetes. We sometimes miss out them in this pandemic of type 2 diabetes, but especially children from poor background, they are even more at risk. And sometimes we don't even know when we lose them. So we created this program called Changing Diabetes in Children, that is creating a support system by providing free diabetes care, free insulin, free monitoring, all the components of care, 6 components of care, to more than 25,000 children across the globe. And we are looking forward to expanding this program to now from 25,000 to almost close to 100,000 by 2030. And we are looking forward to having a partnership with like-minded organizations in taking that mission forward. Especially coming to our times in terms of COVID right now, where the most important initiative that we felt as a responsibility also is to proactively reach out and work with the governments in each of these countries and ensuring that we put mechanisms in place so there is an uninterrupted supply of this life-saving medicines for all the people who are depending on that. And we are really thankful to all our partners and all the ministry officials who have stepped up in creating innovative ways, okay, so that we can ensure this supplies even in this tough times that we face. We also worked as a team and responding to requests for support in terms of donations for insulin, PPEs, as well as syringes across. And as part of our company's global response to this pandemic, we also initiated an emergency donation of approximately $3.2 million in May. And this was to support all our partners working in the humanitarian space to reach out to all the vulnerable populations that they need our support. This was in terms of product donations. It was also in terms of financial support to beef up the supply chain. So I think we were trying to cover the whole spectrum that we can be partners in supporting all the vulnerable groups which are out there waiting for the support. And we are very, very inspired and privileged that one of these beneficiaries also was WHO, in which this was the first of its kind donation for an NCD-related medicine for WHO. And that is also a big inspiration and motivation for the entire team. Talking about other key stakeholders, I think apart from patients, we're also very conscious that we need to do our best to support all the healthcare professionals who are doing their best, taking all the steps in supporting these people during these tough times. And there we are trying to create virtual platforms, which is our new normal, as Maria mentioned, defining the new normal in that finding what could be the right ways of reaching out in terms of a virtual connect, in terms of support, in terms of ensuring that they are able to support the patients in the best possible way, and we can be partner in that journey along with them. And as I was listening, I think the main thing that, and what I get is that together as a team, I think we need to work on creating sort of a coalition for change. I think this is where I think this dialogue, all of us together, it makes such a big impact. For NCDs, especially for diabetes, there are 4 key areas that we need to focus on. One is together build capacity for treating, for educating more and more healthcare professionals and creating those kind of support systems along with the governments. Second, also creating innovative ways for access and affordability initiatives across the NCDs for the vulnerable patient groups. Also, I'm very nice to hear about supply chain intervention, that can we create sort of innovative models about the last mile connect? Can we ensure that it can reach to the patients the supplies during this kind of tough times at their doorsteps? And finally, it's also all about creating empowerment for the patients by creating virtual digital tools that can help them get more information, more awareness, and be more empowered in charge of their condition. So I think this is what, from our side as a team, we look forward to continuing this dialogue with like-minded partners and take this journey forward and create this kind of ecosystem and strengthen that for all the NCDs and especially for diabetes. Thank you so much.
Thanks, Vinay. I really enjoy the fact that this idea about you are having to create a support system for the most vulnerable, aren't you? And that concept of uninterrupted supply of product is just as important as ensuring that you have the continuous attendance of the patients. But then there's that third dimension, which is people have to be able to afford their care. And in these times of economic hardship for so many, that's a really, really big driver of treatment failure and treatment and people not getting access. Really interesting in this recurring theme of reach out and partner with governments that I think everyone's paraphrased that statement so far. Staying with the theme of the most vulnerable, the people who actually need our work and our care the most, I want to move on to Stephen Bard from Ottobock. Stephen was the managing director of Ottobock in South Africa and established Ottobock's footprint in Southern Africa. But earlier this year, he moved to Berlin to join Ottobock's corporate strategy and mergers and acquisition team, where he continues to work towards supporting growth in Africa and emerging markets. Steve, in terms of this supporting for the most vulnerable, what are you seeing in the space of assistive technologies? What are you seeing in terms of that need to support people with disabilities and limited mobility or older people?
Thanks, Ian, for the introduction, and thanks, African Health, for the opportunity. I think, yes, Ottobock is very much in the space of supporting those most vulnerable. We are a company that deals mostly with prosthetics, wheelchairs, and bracing for post-op and other injuries like stroke. And it's been a difficult time for us with COVID. COVID has delayed the procurement of governments. It's impacted the services significantly, and it does impact those that are most vulnerable. From a perspective of Otterbock, we've clearly had to make some significant adjustments in the way that we do business and the way that we support our customer base. And very similar to my peers on the panel, we've had to become virtual in a lot of ways to get our messages out there and to keep the focus going. And we've learned a lot about how effective virtual training can be, and that's been great. One of the fantastic positive outcomes of COVID. But we've also had to support not just our customers, but also those patient interactions by supporting the processes to change, to adjust, because devices are very much, and especially assistive technologies, it's a lot of hands-on connectivity between healthcare professionals like therapists and orthotists. And so we've had to adjust our product and the way we supply to reduce potential infections. So it's been an interesting journey for us, and one that I think we can't do without working as a team. One of the things that we found most useful in the last while has been the ability for us to be part of that team. And I think my core message with regards to the meeting today is that we mustn't forget the auxiliary staff. We mustn't forget the staff that need to get people with diabetes out of the hospitals post that amputation. We mustn't forget the nurses. We mustn't forget the orthotists that have to support that post-stroke patient to be able to also be more independent and more mobile, in line with what we were hearing from Dema on the independence of patients and the ability to take control. So there's a lot that we can learn from that, and it's been an interesting journey. But the second point there is that it is part of universal health coverage, and we must make sure that it does get into those policy documents moving forward. We need to build back better. We need to build back stronger. We need to make sure that all elements are part of the system. And then finally, I think where us as a company, and hopefully many others, have learned is that we've been holding on to a lot of technology. We've been focused on product, and a lot of the efficiencies that we need in Africa can be delivered through process adjustments, can be delivered through solutions that we work through together. And as such, we've been looking at how we make customizing prosthetics easier, simpler. We've been looking at how we get things out faster to customers, faster to remote places. So COVID-19 has impacted the way we need to do things moving forward. So for us, that has been a positive, but it has reminded us that very strongly that the services that we support, that we supply and support with assistive devices is a critical element of care. And so for moving forward, we will continue to be a strong voice and a strong advocate for making sure that prosthetics, orthotics, wheelchairs, and all other topics with related assistive devices is brought into the main line, where we can put the heat on it and make sure that it does not get lost in the noise of COVID. Because ultimately, it's one system, it's a complete ecosystem, and we all need to be playing our role very carefully in that.
Thank you, Steve. I mean, holding on to innovation and technology and focused on product, I think that's the most amazing statement, because that's really one of the most important things that's happened for us, isn't it? We've actually had to go back and revisit everything, every process, every step, every method, because you just don't have the time to be able to cope with the volume and respond appropriately if you just keep using the old ways. So there has been a lot of really fresh thinking, hasn't there? Yeah, the next speaker, Dai Hazumi from IntraHealth International, is the Chief Technical Officer of IntraHealth International. It's a global nonprofit based in North Carolina, and their mission is to support frontline health workers. So where Steve was talking about helping patients transition to home care and that process of step down and step out to home, Dai's operation looks at how to work with the frontline worker in low and middle income countries. and Di leads IntraHealth Center for Technical Excellence in Health Workforce Development and Analytics. So Di, I'm really looking forward to hearing what you've got to tell us about this community-based care and frontline effort. Thanks very much.
Great. No, thank you for Africa Health Business for inviting me to speak. And then thank you very much for introduction, Dr. Barton. I got interested in this topic of managing disease burden and then talking about it partially because the questions that I was asked to talk about was to look at the future. And then also like a little bit more broadening the concept of disease burden. For example, this is not the number from Africa, but then recently from United States, that because of COVID pandemic in United States, about a third of the women are now postponing or rethinking about the number of children they want to have. And then it just sort of like that we are talking about the managing disease burden, but then also that there is a huge element of the well-being and then of the populations, and then also that how the health workers and the technology interact with those the people that are going to be affected from the events like a pandemic and others. And then, you know, we already talked about quite a bit on the technology issues, and then also that the new diagnostics, and then also that how the human resources for health or health workers are able to use those technologies, and then elevating the digital literacies and then understanding of the privacy and others will then coming into a important element for the future. I just want to a little bit even further push our thinking to 20 years from now. And then the reason why I'm sort of like stuck with this number 20 years is that if I think about 20 years ago, we still hadn't really had the global funding dispersed, and then Gavi wasn't there. And then 20 years can really make things different. And then also, so that if we think about 20 years from now, that what kind of future that we're going to be in, and then what we have to do to prepare ourselves for the future seems to be a very important topic in this, the interesting conversation on the managing disease burden. That we recently conducted the research around this, how the future could unfold, and then I just typed in the link to my report, but that there are two axes that which going to influence our future is what we kind of thinking. One is how much that not just about the availability or advancement of the technologies, the digital technologies, and also diagnostic technologies and others, but then how much that the government and then health system in general, including the private sector, can harness the benefits of those technology in more equitable and a universal way, where, or maybe like it become even patchier, like just the creating the pockets of advancement versus maybe one of the issues there. So, and then another axis that which will interact with us is that how much of the health work power structure or authority structure is going to change or transform. If that the current international order of the organizations and then professionalization of the health facility is going to continue or preserved, or that we are going to see a transformation of the healthcare power structure, like self-care assisted by the technologies and then various diagnostics. Now that everybody can have the mobile phone with the diagnostics algorithms. And then also like a role of the community workers, and then what kind of the human interactions are going to be needed. And then all those things that interacting, we may be able to have a much more united, as a Dr. Ademola talked about, the uniting that Africa, and then we may be able to see much more harnessed technologies and then unified healthcare and wellness. And then also transform the way that the health work is being provided maybe there. Or maybe like that we cannot really harness the benefits of the technologies and then let those kind of control go. And then we may have a cyberpunk kind of situation where that the the more intelligent or information savvy people take advantage of those advancements, whereas that a lot of people may become a victim of the data harvest or like a data breach, and also creating another type of the business. Or ultimately, like the current order of the power continues, and then we may be creating the status quo in a major way, and then the efforts going into those preserving. And then we, at the end, if that's the case, it's very unfortunate that the universal health coverage may be declared, but then we still see a lot of patches of or pockets of the unavailability of the health services or quality of care. So what I wanted to say is that there are a lot that we can think of how all those technological innovations and system innovations, and then also that the interaction with the role of the health workers and the health authorities play will shape our future. And then preparing for that, and then thinking about that as that the private sectors and for-profit corporation and government will become really critical to shape our future. Thank you very much for giving me the opportunity to talk about this.
Thank you, Dai. It was really interesting. I think that approach around segmentation and having different approaches is also something that's come through very, very clearly in this pandemic response, is that not even just one methodology of engaging with patients around result return is able to get blanket coverage. You have to have ability to engage with voice, ability to engage with text, ability to engage with web, and so even just within the technology enabled communities, there's a need to have multiple ways in which we engage with people, isn't there? We're going to move on to our final speaker, and that is Arpit Bansal. Arpit is the country director for Sub-Saharan Africa for AstraZeneca. He's based in Nairobi, and he leads AZ's strategic direction, development, and operation of the Anglophone and the Lusophone, the English and the Portuguese-speaking markets in Sub-Saharan Africa. We also hope he's going to give us some inside track on the vaccine development, but I'm not sure. Arpit, I think you've got control over your video, and if you're ready, let's take it away.
Thanks, Dr. Jan. It's a pleasure to be here talking to you.
Is for scientists, those who believe in the potential of science. It starts with curiosity, a surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown. Fueled by imagination, alone and with others. Repeating an experiment 1,000 times to have the chance to get it right. Once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
I guess you guys can hear me well.
We can indeed, Arpit.
Great. So thanks, Dr. Jan. I think what I'm going to talk about is how we at AstraZeneca are also working towards fostering the partnerships within Africa as a continent, and how this really connects to the purpose of COVID-19. So for us, definitely we have realized that respiratory is one of the therapeutic areas which we represent as AstraZeneca. And we realize, this being also one of the, risk factors for patients from COVID point of view. I mean, one of the underlying risk, what can we do to mobilize the resources through the partnerships in Africa as a continent? So just to talk about some of the statistics, we always, we look at Africa as a continent, there are more than 40 million patients who are living with asthma. Once we look at the risk, we are talking about almost 80% of the asthma-related deaths. They are occurring in the low to middle-income countries, and that clearly gives us a strong purpose to work with different stakeholders in Africa as a continent. As our part of responsibility towards alleviating the disease burden in Africa as a continent, we have gone quite big and launching an initiative called Pumua. And for those who can connect with this Swahili word, Pumua means breathe in the Kenyan language. What does this entail? And this is where we are talking about a holistic program to look at how can we work together with the governments around building up the health systems across key geographies in Africa. One of the things which we have also realized, while working in close collaboration with the societies across these geographies, that the capacity building at the healthcare workers is very, very important. We talk about big stuff, but at the same point of time, clearly in terms of the basics, that's where how can we really make sure that they have the right tools, they have the right education, and at the same point of time, the right resources to be able to identify patients with asthma quite early. This also links in how do we really make sure that we can bring the awareness and education. So at this stage, we are in discussion with the Ministry of Health in several countries in East Africa as well as in West Africa, that how can we as AstraZeneca, bring the support at the same point of time, find some common areas of interest between the Ministry of Health and with AstraZeneca. And I think a couple of areas what we are working is developing the guidelines. So working with the thoracic societies within these geographies, working on the asthma guidelines. And while working on the guidelines, we are discussing management of asthma in the context of COVID. And that's very, very important in today's scenario. Point number one is really mobilizing the resources around asthma as a disease area, but at the same point of time, working with the stakeholders to bring those guidelines on the table. At this stage, what I can say is we are in quite advanced stages of discussion in two of the African geographies, and that really gives us a lot of pride, how we are able to really reshape the guidelines, and then ultimately how it connects to the management of those patients. And ultimately, it also links to making sure that we are able to have equitable access of our respiratory portfolio to all the deserving patients in Africa. So for me, I'm quite excited that through this pillar of Pumua, we are able to really redefine the overall asthma care in Africa. Of course, it's a big continent, so the challenge is, do we want to go big and do it across Africa as a continent, or we look at a couple of geographies to start with. As I said, we are in close discussions with the ministries across these geographies, working very closely with the societies, because they really help us to identify the challenges on the ground. And then that's basically the whole intention, that how as AstraZeneca we continue to support the development of these guidelines together with the infrastructure and with the education piece, just to make sure that we can increase the awareness, improve the infrastructure, and ultimately treat the patients well. And I think for me, that's quite a matter of pride with AstraZeneca being a part of this initiative. Thanks a lot. Over to you, Dr. Jan, if there are any questions.
Thanks, Arpit. That was great. And thank you for pulling us back a little bit closer to time. We've got about 7 minutes to do some question and answer stuff if we don't land up with closing remarks from everybody. So, Di, I want to come back to you first, please, because we didn't ask anything at the end of your session about in the role of digitization and big data and AI in controlling the spread of disease. Something I hear a lot about is, so what about data privacy and what about data ownership? What are your thoughts on those two?
Thank you. I think that you targeted that question to me, right? Just
Yes,
sometimes.
I do.
Yeah,
Yeah.
thanks. I think that the one of the really interesting the study that the currently being done by in Africa, what I heard learned is looking at how much of the data harvesting or like a data tourism is happening in Africa in order to create improve that the AI algorithms to be used for the global by some of the companies. I'm not talking about those companies that more of the startup companies. And then it's increasingly clear to our organizations that it is important that the health workforce and then also that the government who manages the health systems to understand that the interactions and then that those data ownership of the health related data, because many of the health data are extremely valuable to the many organizations. But then at the same time that I do feel, and then I also believe that the extreme restriction on the access to the health data in a way also that prevents the most critical innovation from happening. So I don't really have a very clear sort of like a clean-cut answer for you. I understand that the governments and then also health systems desire to control and then protect the patient's privacies, and then also like elevating the general understanding around those issues. But then at the same time, we also want to make sure that it would be, and then also it would be great for the Africa, many of those countries to be able to collaborate more systematically in agreeing that how those data can be used for the advancement of the health systems rather than just that for the profit taking kind of purposes. I'm not so sure if I could answer, but that's a really dear topic for our organization. And thanks.
That's wonderful. Thank you, Dai. And Ademola, I hope you're still there. You made the very, very pertinent point about we have to build trust and we have to answer this question about the numbers. And one of the questions that we got on the question forum was, so how do you actually enforce, manage, detect when we're not actually doing enough testing? And how do you actually manage that and how do you get around that? And then the second question, which was very similar, was how do we balance this need between the government being accountable for delivering service and yet the government being the moderator and enforcer of quality and standards? And how do we get over that marking your own homework type thing?
Well, thank you very much. The point we have to accept really for going forward for the continent is we are where we are now. And what we have to do is build back better and move forward. Now, in terms of the tests, one of the things I've always told colleagues when we begin to compare data from different African countries to try to show the projection of the disease is that slide is totally useless, because different countries got different testing mechanisms, different coverage, you cannot just begin to look at numbers of different countries and then bring them together. For example, the number of tests done in Kenya, a country of 47+ million, is much more than that done in Nigeria of over 200 million people. So how do you begin to compare that? So we must help each national government to interrogate its data sets differently and then help them to engage more with their communities. And the same now goes for the issue of them regulating. We must find a way to bring private sector and communities together and help governments, because regulation of the health system will not be done differently outside from the accountability mechanisms that government has as a whole. Ownership of governance of whatever systems, whether health or commerce, must begin to reside with the people, and it starts with democratization of data, like you had asked in the previous question. Thank you.
Thanks, Ademola. And then my last question in terms of the time running down would be to Philana. Philana, you made some great points around we need to collect more blood. But one of the questions we got on the forum was, even in Kenya, there's been lots of things in the press about the lack of financial resources and support of the services. And then also a second part to that question. So how do we force the conversation around resources? And what is your take on the use of patient advocacy in order to be able to support that kind of effort?
Thanks, Ian. I think the first thing is in Kenya, part of the problem is that the National Blood Transfusion Service are required to collect and screen and supply blood to every public facility in the country. But the problem is there's not really a solid reimbursement mechanism in place that allows them to do that effectively. So one thing that needs to be done is a proper reimbursement mechanism needs to be put in place, not necessarily for them to make a profit, but for them to keep operating and doing what they need to do. In the past, a lot of the funding came from PEPFAR, and unfortunately, when that funding came to an end, the blood transfusion service was suddenly facing huge financial challenges. So it would be important that funds were earmarked for the blood transfusion service and for blood and blood safety in Kenya. And I know at the moment in Kenya, there's a lot of work going on to actually strengthen the blood laws, and hopefully there'll be mechanisms there to do that and ensure that the blood transfusion service has funding. In terms of advocacy, this is very important. A lot of studies have shown that if you manage to get someone to donate blood 3 times, then you're not going to have to ask them to do it again. They're going to voluntarily do this. And the problem in Kenya and most African countries is we don't have voluntary blood donors. Most people donate blood when they have a patient, or a family member or a friend who requires it. So it's really important to have donor management and donor recruitment programs in place that'll recruit new donors, but also keep the ones who donate keep doing that. And there are a lot of organizations that COBA is partnering with, including the Global Blood Fund, who are experts in this area. And they actually help blood transfusion services design and develop the programs that keep the blood coming into the blood banks. So, I could talk about this for hours, but just in short, those are my answers. We need funding to be earmarked for blood transfusion services, and we need donor management and recruitment programs to ensure that there's advocacy for blood collection and donation.
Thank you, Philana, and thank you to all the panelists. It's been a really great conversation. I've got loads of notes and loads of action points of my own. I hope for the audience, you've got a few thought-provoking issues that you want to dig into more as well. And I notice on the chat group, there's been lots of sharing of email addresses and contact details. So hopefully we're going to spur a whole bunch of conversations as a result. Marluz, I'm really sorry to have run over time like this, but back to you.
Thanks, Ian, and thanks the panel for a very interesting session and great insights. We really appreciate you all coming in and stepping up. And also thanks to all the participants in the call. I will just do a quick recap of the poll results that came in. As you can see on the screen, the first question was, what are the biggest challenges in managing Africa's disease burden? The largest response came to the lack of skilled workers, HRH. And then the number 2 was limited focus on prevention and the high donor dependency as runners up for that question. I will not go further into the analysis of that because of time constraints. Can we go to the next question? The second question is what factors would strengthen national health systems for the disease management? The biggest response came to the partnerships, the PPPs, and the intersectoral collaboration, which shows the need for partnerships and know what everybody is doing. The follow-up response came from development and implementation of strategic health financing policies and plans. The next question. What actions are needed to enhance the private sector's participation in healthcare? Here we have a great a firm winner, developing mechanisms for creating and enforcing quality standards for health services and medical product manufacturing and distribution. So more focus on that aspect would help private sector participate better and more. That were the questions that we are going through. Lastly, I would like to thank all our event partners that participated or that participate throughout our series. Thank you very much. Without you guys, it would not be possible to host these webinars every week this month. And then I would also share the next webinar that we have is next week, same time, different links, so register for that one. It's about human resources for health with an interesting panel as well. I see majority are females. We always like that. So looking forward to that. Thank you, everybody, and see you next week. Oh yeah, in case you want to contact us, you can reach out to me or my team. Contact is available there on the slide. Thanks and have a great evening, afternoon, or morning, wherever you are in the world.